Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, bringing you all that you need to know about COVID-19 on Thursday, the 10th of September. Our top story, the numbers. India is now very close to 1 lakh cases per day mark, which is unprecedented, and no other country has seen that. In just the last 24 hours, we've seen almost 96,000 cases. When it comes to states, Maharashtra continues to be the worst hit with 23.5 thousand cases. And it is so grim and the numbers are so serious that if you look at the states across the world, then Maharashtra is number one in that as well. It's worst hit than even California in the US or Sao Paulo in Brazil. So those numbers of major concern, very close to the 1 lakh cases per day mark. And what authorities are saying is that the upcoming festive season is a major cause of concern because it may exacerbate the situation. What is also of concern are the rising number of cases in Delhi, where Delhi has now crossed the 2 lakh mark on the total number of cases, which we haven't seen in any other state. We are also seeing in the last 24 hours more than 4,000 infections. However, authorities are saying that this may be because of the increased testing, and the good news is that the positivity rate in Delhi has dipped. The other cause of concern across the world is that vaccine makers and Astrazeneca, which is the front runner among all the vaccines in the world, has now been stopped because one of the UK participants developed an unexplained illness. They said that they have developed an inflammation of the spinal cord, which is called transverse myelitis. And they say that this may not be a setback for vaccine development across the world, but there has to be a committee that investigates into whether this is caused because of the vaccine that was being administered, or it is just a coincidental illness that has taken place. Now, Serum Institute of India, which had partnered with AstraZeneca, said that this does not stop their trials here in India. They will continue. However, they have also been issued a notice by the Drug Controller General of India, who asked them why is it that SII or Serum Institute did not inform them of what has happened in the UK. So those developments are also progressing as we speak. Now, one of the things of concern is the fact that COVID patients could be at the risk of developing lung fibrosis. AIIMS doctors have recommended lung transplant for 2 recovered patients. And they say that 60 to 80% of those who have the coronavirus develop some other disease, from body ache to more serious ones that require oxygen. Only 12% remain symptom-free. So this is something for us to think about. And finally, as we see bars and other places open up in the capital, it's interesting to look at the UK, which has now introduced the rule of 6 for socializing. Because they're seeing a resurgence of cases in the UK as well as the rest of Europe, they've now said that initially it were groups of 30 could socialize, but now they've said not more than 6 people can get together and socialize because they're seeing cases go back up again. So it just shows how careful people are being rest of the world and how careful we have to be because of the fear of a resurgence of infection. Those are the news updates. Keep tracking them on hindustantimes.com.